8 silent warning signs your arteries may be narrowing after 60. Don't ignore these symptoms. What if your body has been quietly warning you that your arteries may not be as healthy as they once were, but you've mistaken those warning signs for nothing more than normal aging? Many adults over 60 don't realize that artery narrowing often develops slowly over many years. There are usually no obvious symptoms at first. That's why it's often called a silent condition. You may feel a little more tired than usual. You may notice discomfort when walking, or perhaps you're becoming short of breath during activities that once felt effortless. It's easy to brush these changes aside, but sometimes they can be signs that your heart and blood vessels deserve medical attention. The encouraging news is that recognizing these warning signs early and discussing them with your healthcare provider may help identify problems before they become emergencies. In today's video, we'll reveal 8 silent warning signs that may suggest your arteries are narrowing, explain why they happen, and share simple lifestyle habits that help support heart and blood vessel health. Be sure to stay until the end because the final warning sign is one many people dismiss as just getting older, even though it can sometimes signal a circulation problem. Let's begin. As we age, our arteries naturally become less flexible. However, conditions like high blood pressure, diabetes, high cholesterol, and smoking can contribute to plaque buildup inside the arteries over time. This process, called atherosclerosis, can reduce blood flow to important organs. Keep in mind that these symptoms can have many different causes. They don't necessarily mean your arteries are narrowing. Only a qualified healthcare professional can determine the cause through a proper evaluation and appropriate testing. Now let's explore the first warning sign. Meet David. At 71 years old, he still enjoyed gardening every morning. But something had changed. He noticed that walking across his yard left him more tired than before. His legs sometimes cramped after a short walk. Occasionally, he felt pressure in his chest while carrying heavy bags. He blamed age. His family blamed retirement. His friends said everyone slows down eventually. Months later, during a routine medical appointment, his doctor recommended additional heart testing after hearing about his symptoms. Those tests revealed narrowed arteries that required treatment and lifestyle changes. David's story is more common than many people realize. Artery narrowing usually develops slowly. Your body often adapts gradually, making the symptoms seem almost normal. That's why so many people ignore them until they become severe. Recognizing these changes early gives you the opportunity to seek medical advice before a heart attack or stroke occurs. Think of your arteries like highways that carry oxygen-rich blood throughout your body. When they're healthy, blood flows smoothly. Over time, fatty deposits called plaque can build up inside the artery walls. As the opening becomes narrower, less oxygen-rich blood reaches your muscles, brain, heart, and other organs, especially during physical activity when your body needs more oxygen. This reduced blood flow may contribute to symptoms that many people mistakenly blame on aging. Now let's look at the first warning sign. Many people imagine a heart problem always causes sudden, severe chest pain. In reality, some people experience only mild pressure, tightness, heaviness, or discomfort in the chest during physical activity. This discomfort often improves after resting. Chest discomfort can have many causes, including heartburn, muscle strain, or lung conditions. But new, recurring, or worsening chest pressure should always be evaluated promptly. If chest pain is severe, lasts more than a few minutes, or occurs with symptoms like shortness of breath, sweating, nausea, or pain spreading to the arm or jaw, seek emergency medical care immediately. Do simple activities suddenly leave you out of breath? Walking upstairs, making the bed, carrying groceries. When narrowed arteries reduce blood flow to the heart, some people notice they become unusually short of breath during activities that were once easy. Shortness of breath can also result from lung disease, anemia, or many other conditions, so it's important not to assume the cause. However, if it's new, worsening, or limiting your daily activities, it's worth discussing with your healthcare provider. Have you ever noticed aching, cramping, or tightness in your calves or thighs while walking that improves after you stop and rest? This pattern may occur when the muscles in your legs aren't receiving enough oxygen-rich blood during exercise. Doctors call this symptom claudication. People often assume it's arthritis or simply getting older. While those conditions are certainly possible, recurring leg pain during walking deserves medical attention because it may also be related to circulation. Have you noticed that your feet or hands always seem unusually cold, even when everyone else feels comfortable? As we age, it's normal to feel colder than we once did. However, poor circulation caused by narrowed arteries can reduce the amount of warm, oxygen-rich blood reaching your hands and feet. Some people also notice their toes becoming pale or slightly bluish. Others complain that their feet never seem to warm up, even with thick socks. Cold hands and feet can have many causes, including thyroid conditions, anemia, or certain medications. But if this is a new symptom or it's getting worse, it's worth discussing with your healthcare provider. Have you ever had a small cut that seemed to take weeks to heal? Healthy blood circulation delivers oxygen and nutrients that your body needs to repair damaged tissue. When circulation is reduced, healing may slow down. Even a tiny scrape can linger longer than expected. This is especially important for older adults and anyone living with diabetes. Checking your feet regularly for cuts, blisters, redness, or sores is a simple habit that may help you catch problems early. If you notice wounds that aren't healing or appear to be getting worse, seek medical attention promptly. Do you occasionally feel dizzy or lightheaded? Perhaps you feel unsteady while walking or experience brief moments where you feel like you might faint. Dizziness has many possible causes, including dehydration, inner ear disorders, medication side effects, and low blood pressure. In some cases, however, reduced blood flow to the brain may contribute to these symptoms. If dizziness is frequent, severe, or occurs alongside chest discomfort, weakness, or difficulty speaking, seek medical care immediately. Never ignore sudden dizziness accompanied by other concerning symptoms. This is a topic many people feel uncomfortable discussing, but it's important. For some men, erectile dysfunction can sometimes be one of the earliest signs of blood vessel disease. An erection depends on healthy blood flow. When arteries become narrowed, blood flow may be reduced. Of course, erectile dysfunction has many possible causes, including stress, hormonal changes, certain medications, and other medical conditions. But if it develops suddenly or becomes persistent, it's worth mentioning to your healthcare provider, not only for quality of life, but also because it may provide important clues about your overall cardiovascular health. The number one warning sign on today's list is persistent fatigue that seems out of proportion to your daily activities. Are simple tasks leaving you exhausted? Walking around the grocery store, making the bed, working in the garden, playing with your grandchildren? When your heart has to work harder to deliver oxygen-rich blood throughout your body, everyday activities may begin to feel unusually difficult. Many people simply blame age, but while some slowing down is natural, a noticeable decline in your ability to perform routine activities shouldn't automatically be accepted as normal. It's worth having a conversation with your healthcare provider to determine the underlying cause. Now let's discuss 3 common mistakes. The first mistake is waiting until symptoms become severe. Many people ignore mild warning signs because they come and go. Early evaluation often provides more treatment options than waiting until an emergency occurs. The second mistake is assuming supplements alone can clean out clogged arteries. Be cautious of products that promise to reverse artery disease quickly or naturally. Healthy arteries are supported through a combination of medical care, healthy eating, regular physical activity, avoiding tobacco, managing blood pressure and cholesterol, and following your healthcare provider's recommendations. The third mistake is skipping routine health screenings. High blood pressure, high cholesterol, and diabetes often have no obvious symptoms in their early stages. Regular checkups can help identify these conditions before they lead to serious complications. Your body often gives subtle clues when something isn't quite right. Chest pressure during activity, shortness of breath, leg pain while walking, cold hands or feet, slow healing wounds, dizziness, erectile dysfunction, persistent fatigue. None of these symptoms automatically mean your arteries are narrowing, but they are signals that deserve attention, especially if they're new, worsening, or affecting your daily life. Here's one bonus tip. One of the best things you can do for your arteries is to stay physically active in ways that are safe and appropriate for you. Even a daily walk, eating a heart-healthy diet, getting enough sleep, and keeping up with routine medical care can make a meaningful difference in supporting your cardiovascular health. Before you leave, tell us in the comments, which of these warning signs surprised you the most, and have you ever experienced any of them? I'd love to hear your thoughts, and your experience could encourage someone else to take their heart health seriously. If you found this video helpful, please like, subscribe, and turn on notifications. Every week on Cindy Health, we share practical, easy-to-understand health information designed to help adults over 50 stay healthy, active, and informed. And don't miss our next video, where we'll reveal 9 foods that may quietly damage your heart after 60, and the healthier choices you can make instead. Thank you for watching Cindy Health, and remember, your health is your greatest wealth. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you experience symptoms such as chest pain, sudden shortness of breath, weakness, difficulty speaking, or other concerning symptoms, seek prompt medical evaluation or emergency care when appropriate. Always consult a qualified healthcare professional regarding your individual health needs.